Well, welcome back to Major Tom Haviland. Tom, thank you for coming back on.
Well, thanks, Dr. Campbell. Reason I'm coming back on is we have a pretty big break in the white fibrous clot story. Last December, when I was running my worldwide Embalmer blood clot survey for the year 2024,
Yeah.
one of the U.S. State Funeral Director Association presidents, Mr. Taylor Moore from the Tennessee Funeral Directors Association, reached out to me and said, "Hey, Tom, I'd like to have you come present to our embalmers and funeral directors at our 2025 conference coming up in June of 2025." And that happened a little over a week ago on June 8th. I actually traveled to Franklin, Tennessee, just south of Nashville, to speak at their Tennessee Funeral Directors Association annual convention. And what was interesting about that is, John, I went there the day before with my Survey Monkey assistant, Miss Laura Kastner, and her sister. All three of us went to the event. And they had a reception the night before, about 2 hours from about 5 to 7 p.m. And I met there were 60 people at the reception. About half of them were funeral directors and embalmers. So I got a chance to talk to them, and I walked around. I had my vial of the clots with me that Richard Herson's given to me, and I asked them, have you seen the clots? And one of the very first embalmers I talked to, John, actually said, "What are you talking about?" He pulled out his phone and he showed me a white fibrous clot photo that he had removed from somebody just a month ago in May. And then other embalmers and funeral directors came up to me during the reception, and they said, not only I'm interested in coming and listening to you tomorrow, my wife wants to come too. So even the wives were interested in coming to listen to my presentation. In fact, one of the wives works at a Tennessee hospital, and she's been seeing strange things in the hospital. So she was very excited about coming to see the presentation. There was one older gentleman that was skeptical. When I showed him the white fibrous clots, I said, have you been seeing the white fibrous clots? And he said, "Oh, you mean the chicken fat clots?" And I said, No, this is different. The chicken fat clots, as we know, that embalmers have been seeing forever. They're yellowish in color, they're smaller, and they tear very easily. Much different than these large white fibrous clots, that are tough and rubbery. Yeah. So, and what was interesting about that, John, is the next day after I gave my presentation, that gentleman did a completely 180. He said, "I'm so glad you came. I'm so glad you explained that these are not chicken fat clots. These are white fibrous clots." So, as you know, looking in the old pathology books, you can't find these things.
Correct. So just before we look at your data, Tom, which I want to come on to in a minute, what was the sort of impression talking to them? How many active embalmers were there?
Yeah, there were about 28 that took my survey. I actually ran a survey at the event. And as you'll see, I think we're going to show a clip at some point of me talking to the embalmers that day. There was about 30 of them there was a room full of 60 people. About half of them were embalmers and funeral directors. And what's interesting is I asked all the embalmers in the room, because I didn't know how many were in the room on the day of the event, that Sunday, and I asked them to raise their hands if they were an active embalmer, actively embalming. Yep. About 30 of them raised their hands. So then I asked them, okay, if you're seeing the white fibrous clots, keep your hand up. But if you've not seen the white fibrous clots, put your hands down. And what was interesting is when I asked that question, John, only about a third of them put their hands down. So about 2/3 of the embalmers and funeral directors were telling me, "Hey, I am seeing the white fibrous clots." So when I ran a paper survey that same day, I got confirmation of that. And we'll go through the slides, and I'll show you how many we're seeing that.
So Tennessee Funeral Directors Association, these were embalmers and funeral directors from all over Tennessee, were they, Tom?
Correct, all corners. And it's a bizarre state. It's not that many miles north to south, but it stretches long, east to west.
Yeah.
Tennessee does. But they were from all over the state, all corners.
So first question here, what is your current position?
Yeah, there were 28 that responded to the survey. Of those, 3 are funeral directors only. They don't do any embalming. 3 of them were active embalmers only, so they don't do any funeral directing. But what's interesting, John, is 22 of them were both funeral directors and active embalmers.
Right.
And that's I wasn't too surprised, because I know a lot of funeral directors, when they go after their license, they do go after both when they go to mortuary school, because it's easier just to pick up both
Sure.
your embalming license and your funeral director license.
And these were experienced embalmers.
Yes, in our 2023 survey, we asked that question, if you remember, and most of the embalmers had an average of 15 years of experience, so they know what the blood looks like before COVID, during the year of COVID, but no vaccines, and then the year of COVID with the vaccines. And they typically do about 100 bodies a year, so they're embalming a lot of bodies.
Yeah.
Question number 2, we asked straight away, hey, have you seen the white fibrous structures, clots, in the veins and arteries of your corpses in the first half of 2025?
Yeah.
And as I said there, John, 18 of the embalmers and funeral directors said, yes, I'm seeing the white fibrous clots still in the first half of this year. And this was, important to us because the last survey I did was, covered through the end of 2024. So myself and my assistant, Lori Kasner, we were anxious to see what the embalmers were seeing in the first half of 2025. So these Tennessee embalmers are kind of our canary in the coal mine. As you see, 10 of the embalmers said that they did not see the white fibrous clots. So that's
a slight reduction in previous years then, which I suppose is vaguely encouraging. The trend is somewhat down, but still 64% is pretty high.
Exactly. Next slide.
Yeah.
So then we asked them, hey, what percentage of your corpses have you seen the white fibrous clots in? And if you average the bars together, you get 17% of the corpses in the first half of 2025. Again, that's down from our 2024 worldwide survey. Remember, it was 27% in our last 2024 survey. So that's a good indication, right? That's good. Again, I have to caveat, though, this is a small sample size, right? It's 28 embalmers versus the 301 we had taken our last worldwide survey. So,
but this is... if this survey here had been conducted in Tennessee in 2019, the result would have been 0.
Yes, it should have been 0, correct, because this is a phenomenon these embalmers had not seen, prior to COVID. Now, there's a couple of really old embalmers and funeral directors that actually remember the case of white clot syndrome back in the late 1980s, early 1990s, that was caused by heparin. I don't know if you remember that. There was a heparin-induced it was called white clot syndrome, and they've solved that by actually reducing the strength of the heparin, and then that went away for people who had this allergic reaction to heparin that was actually forming these white fibrous clots. What's interesting about that, John, is that particular condition was being driven by sulfur. We think this particular condition is being driven by phosphorus, and the two of them just happen to sit side by side on the periodic table. And they had.
I do remember something vaguely about that. It was fairly. Vague memories.
Yeah. So, we think that because they have similar bonding properties, the phosphorus is actually driving the reaction of these white fibrous clots this time.
But anyway, we know for sure that data's there, 17% of corpses in the first half of 2025.
Yeah. So that's 1 out of 6 dead bodies still has these white fibrous clots in them. And, it makes you wonder what percentage of the living are walking around right now with these things possibly forming inside them. I don't know if it's 17%, but it's it's concerning, right?
Yeah, there's mysteries here still, Tom. That
and I've been,
and of course most of the evidence is being buried or cremated, unfortunately.
Yeah, and I tried to run a cath lab worker survey last year with vascular surgeons, endovascular specialists, cardiologists, but they refused to take my survey. The U.S. Society for Vascular Surgery, located in Rosemont, Illinois, with 6,300 members, refused to take my survey. The UK Society for Vascular Surgery also declined to take the survey. So it's a shame, isn't it? Because unlike the embalmers, these doctors do have access to the COVID vaccination records of their patients, and they could have told us if there was any correlation between people they're seeing in the living people in these cath labs with white fibrous clots, if there's any correlation between that and people who've taken the vaccine.
And of course, the embalmers don't have access to detailed medical.
Usually not unless the family of the deceased volunteers that information.
Yeah, and it's very difficult to sort of ask that. But that data's there. It's a pity it's not publicly accessible. Anyway, let's stick to what we know for sure. Question 4.
So one of the new questions we asked this year, John, is what's the longest white fibrous structure clot that you've removed from a corpse in 2025? And 5 of them said none. 12 embalmers said, 5 said none.
Yeah.
9 embalmers
Nine.
said 9 said between 1 to 2 inches long. 7 said between 3 to 5 inches long. 5 embalmers removed a white fibrous clot that was between 6 to 12 inches long, and there was even one that said he's seen a clot and removed it that was over 12 inches long, John.
And Richard Hirschman and John O'Looney, of course, working in the United States and United Kingdom, I've seen longer ones than, several feet long.
Yeah, Richard Hirschman has one in a tube. It's 19 inches long, John. It's about 3/4 of an inch wide. It is huge.
Yeah.
It is
Yeah,
huge.
and John O'Looney told me very similar accounts as well.
Wow.
Yeah.
Next question.
Yeah, so question 5.
Yeah, another new one we asked the people this year is, has any family member of the deceased ever asked you to look for the white fibrous clot structures in their loved one, or asked if you found them in their loved one? And only one embalmer out of the 28 responding said that the person's ever asked them that question, which I wasn't too surprised, I guess. First of all, a lot of family members may not know about the white fibrous clots. But then they could know about them, but maybe are too embarrassed to ask, right? Because
very few people do know about them, Tom. I think this is part of the problem and part of the mystery here. And
yeah, another reason could be that maybe there's nothing unusual about the death, so there's no reason to be suspicious. But then I think there might be some of those people that are in denial. Maybe they do know about the white fibrous clots. Maybe they suspect their loved one passed away from a stroke or heart attack from the white fibrous clots, and maybe they even recommended that their loved one take the COVID vaccine, so they may not want to know the answer to the question. So just some possible reasons why
we can't know that. But to tell you the truth, I'm a little surprised that one relative did ask for that to be looked out for, because there's so little public knowledge of this bizarre acute phenomena. It's Anyway, question 6, Tom.
Yeah, we asked, have you seen any evidence of the micro-clotting, known as they call it the coffee grounds or dirty blood in the drainage from the corpses in 2025? As you can see, there's 70%, 19 of the embalmers said, yes, I've seen the coffee grounds. So, this is something they have seen prior to COVID and the vaccines, but in way less than 5% of their corpses. Typically, corpses that have patients that were taking heavy chemotherapy. So then the next question we asked them, John, was...
So basically these dirty blood, the coffee grounds is tiny little blood clots, isn't it?
Right.
2018, 2019, you probably expect about 5% of corpses to have them, and it seems to have gone up to about 70%.
Right, so that's at least if you go to the next slide, it's going up to 17%. 70% of the embalmers are seeing it.
70% of the embalmers are seeing it. Right,
yeah,
got you.
They're seeing it in 17% of the corpses, 1 out of 6 corpses. But you're right, micro-clotting, John, can be just as dangerous as these large white fibrous clots.
Oh, heck yes.
Micro-clotting occurs at the capillary level, your very small blood vessels. It can block the exchange of oxygen at the lungs and then carrying that oxygen to all your major organs of your body, including your brain, your eyes. That's why a lot of people might be getting brain fog these days or having vision problems. They may be experiencing micro-clotting in their head. So
it's very hard to say that, but I mean, we know that this data is accurate, that 7 out of 10 embalmers were seeing it, and 17% of corpses, which is maybe 3 times the rate of what it was from your data.
Right. And we know from Dr. Risa, Risa Pretorius in South Africa, she's been working with the microclots, particularly in like stroke patients, and she's done thioflavin T staining of them and proven that they are indeed misfolded amyloid material, AMYLOID, misfolded proteins. So this is a serious issue.
And then the red blood cells will clot onto that, presumably.
Correct.
That's what makes it coffee ground colour, because it's the coffee ground that is from the blood.
Right. Next question.
8.
Yeah, we then asked a question that we had asked back in our 2023 worldwide survey. We asked, have you noticed an increase in infant deaths in the first half of 2025 compared to the years 2019 and prior? I was a little shocked by this, John. 39% of them, 11 out of the embalmers said that, I'm seeing an increase in infant deaths, either at, in my funeral home or at the local morgue when they go to pick up bodies. So, and as the spike protein from the vaccine is getting through to the child. They're finding it in the placenta when the woman delivers the child. She also delivers placenta. They're finding the spike protein there. They're also finding the spike protein in the mother's milk as well. So this is quite unfortunate if the spike protein and possibly the mRNA are getting through from mother to child.
If we only had the data to know if they were highly correlated, but
right, yeah.
It's a pity we haven't got that data. Anyway, question 9, Tom.
Yeah, so then we asked them, what percentage increase in infant deaths did you see in 2025 compared to the years 2019 and prior? And if you do not include the green bar, there were 14, but if you just include the average of the blue bar and yellow bar together, you get an increase of 14% in infant deaths in 2025 compared to the pre-COVID years for just those that saw the increase.
Yeah.
So again, very alarming.
It really is. Really is.
Another question we asked.
Question 10.
This is a question we also had asked in our worldwide survey as well in 2023. We asked what age groups, check all that apply, did you see an increase in the number of clots of any type in 2025 when compared to the years 2019 and prior? And the good news is you can see very few said anybody that was all the way up to 35 years old. Only one, in fact, Embalmer said he saw an increase in clotting in 2025 for the younger age groups up to that age. But then look at starting at year 36 to 50, that age group, it jumps to 9 and then goes up, from there. What bothers me about this, John, is you don't usually think of a 36 to 50-year-old dropping over with a stroke or a heart attack. Usually you don't see that until they're in the late 50s, early 1960s, early 60s. But as you know, this information dovetails very closely with that of the work of Edward Dowd. He's been looking from a completely different angle from death and disability data, and he noticed in the insurance industry, and he noticed in the third quarter of 2021 there was a tremendous spike in death and disability in that 36 to 50-year-old age working group, which you would not expect to see. It was about a 40% jump starting in the third quarter of 2021. And as you know, that was the exact time here in the United States that a lot of the companies were mandating the vaccines on their workforce. Now, Joe Biden mandated it on the military, the government civilians, and defense contractors, but he also tried to mandate the vaccines on any company that had more than 100 employees. Now, our Supreme Court eventually shot that down, but a lot of companies, they acted preemptively, and they made their employees take shots anyways. So he saw that phenomenon. So it's dovetailing, perfectly with the data that we're seeing from this.
Yeah, it's another correlation, isn't it?
Yeah, another correlation. We've seen too many over the last 4 or 5 years.
There's a lot of correlations around at the moment.
Yeah. So at the end of all of our surveys, we allow the embalmers to give us more comments about what they're seeing in their embalming room. And just 3 of the 28 answered this time. Comment 1 says, we've seen an increase in stillborn deaths, most around 19 weeks. I'm not sure why would it be 19 weeks, John, or just something he noticed, or I don't have any rhyme or reason to.
I don't know. I mean, the sample size is relative. I mean, this is just one comment, but it sounds like this individual embalmer has seen several deaths at that stage of pregnancy. That's distressing for everyone concerned.
It is. Comment 2 was saw several white fibrous clot structures in 2023 and 2024, but none this year. So that's an embalmer that would have answered no to my first question about have you seen the clots in 2025, but he actually did see them, in 2023 and 2024, just hasn't seen any this year. But I have done less embalming this year than the past few years. Also, we don't get a lot of infants. And that's true. Some funeral homes get more infants than others because some will actually perform that service for free, whereas others charge for it. So obviously the parents will probably go to the funeral home that does it for free out of compassion towards the grieving parents. Comment 3 was, I do not do very many embalmings or burials, so that's why I don't have many young people.
Yeah.
So that's it for the survey, but this was a big deal, right, John? Because it's the first time that like I said, a state funeral director association has acknowledged that these clots are real and that they are prevalent as well.
Now, it would be so interesting to get this data from the other 49 states, wouldn't it, Tom?
and I sent out an email to all of them the other day saying,
Yeah.
I'd love to come to your convention and speak to you, just like I did the embalmers and funeral directors in Tennessee. So, and I'm willing to pay my own way to get there. So there's no reason for them not to invite me. I would love for them, to give me that information, and then we can get a larger data set and really kind of see what's going on here.
Well, yeah, indeed, yeah. I mean, we would need release of other medical data.
So, now that we have this visible proof, and like I said, when you show the clip of the embalmers raising their hands at the meeting, the audience, they'll see that there is definitely proof that this thing is happening, and that these things are prevalent. The naysayers may say, okay, I'll concede to you the fact that the embalmers are indeed seeing these unusual white fibrous clots. I'll even concede to you that they're seeing a lot of these things. But that doesn't mean that the COVID vaccines are causing them. Well, I think we have some fairly strong proof here that there's something going on, John, because this first slide here, this is an image, actually two images, out of a paper that appeared last year in Nature magazine and online by Ryu and colleagues, R-Y-U and colleagues. The name of the paper is actually called Fibrin Drives Thromboinflammation. But in that paper, in figure 1, there's this photo of under a scanning electron microscope of what our normal human plasma is supposed to look like when our fibrinogen that's in a liquid form in our plasma converts into a white solid fibrin. And that's on the left.
These are the fibrin strands that would be the start of a clot.
Correct. And, they are supposed to look like nice, smooth spaghetti noodles at high magnification. They collect our red blood cells and our platelets and then form that clot, right? And if you have a cut on your arm, for example.
Correct.
And then once the wound is healed, then we have plasmin, or that enzyme comes along, and it breaks down. It attaches to that clot and breaks it down. Then you're good to go again. But look what happens over on the right, according to the Ryu and colleagues, when human plasma, when the fibrinogen comes in contact with spike protein, either from the virus or from the vaccine. It gets all twisted, misfolded. You see all these nasty nodules on there. So then it becomes difficult for plasmin to attach to that clot and break it down. So that's when you get these large white fibrous clots persisting. So if you go to the next slide, the one below that there, you see that Richard Hirschman sent about a dozen samples of the clots that he removed from corpses, John, to a neuroscientist in Japan named Dr. Kevin McCarran. And Kevin took a look at the embalmer's clots. He took a 5 micrometer slice and put it under a scanning electron microscope at a magnification of 5,000. And this is what it looks like, John. What do you think? Does it look more like the smooth spaghetti noodles, or does it look more like the nasty, twisted mess?
No, I can still see the lumpy bits, so it looks like the twisted form.
Exactly. So, and then if you look at the last photo on there, if you back out to about 1,000 magnification from the 5,000 magnification, this is what it looks like, the embalmer clot at a magnification of 1,000. It's no wonder our plasmin cannot attach to that and break that down, right? So then you get these huge rubbery white fibrous clots that just, persist to the point where, as you and I know, only vascular surgeons and cath lab workers can go in and get these things out physically. TPA, tissue plasminogen activator, does not dissolve these things. So they have to go in and physically remove them with flexible catheters that either scrape them out, suck them out, or lasso the clot and pull it out.
So the clots have got fibrin and amyloid protein. Is that basically what they seem to be made of?
Correct. In fact, in that paper by Ryu and colleagues, one of the subparagraphs says basically fibrinogens binding with the spike protein. And what we think is also happening is we believe that the phospholipid nanoparticle is as well. We think the phospholipid nanoparticle, at the moment that it opens up to release the mRNA inside, is exposing its phosphorus heads, and those phosphorus heads have a great affinity for our natural blood clotting protein fibrinogen, so it binds. And then the spike protein is also becoming phosphorylated and it then binds with our fibrinogen as well. So,
just incredible though that this isn't all over the mainstream pathology journals. It's basically Richard's basically. This guy in Japan's just done this as a favour to Richard Hirschman, really. I mean, it's ridiculous that this isn't being done as a formal research project.
And I have reached out to beg the CDC, the FDA, university labs all over the world to get their own samples of the embalmer clots and do these same tests that Dr. McCarran and another team led by Mr. Greg Harrison in Sydney, Australia, are doing with the clots to either confirm or refute what they're finding, right?
Yeah,
but
and these clots can be readily collected because it's not like a tissue sample. It's not part of the patient.
Yes, absolutely. There's nothing unethical about it.
There's nothing unethical about collecting it.
Right. In fact, we don't even tell the embalmers don't even tell them what corpse it came out of. They'll just say male, 50 to 60
anonymized,
year old, or female, 70-year-old female, that kind of thing.
Well, I mean, professional undertakers and embalmers are very discreet people, obviously by nature of the profession. It's
absolutely
with professional standards, you would expect them to be.
So that's it for the slides.
Yeah.
So basically, again, I think this is a slam dunk, John. We've got visual proof of the white fibrous clots at an eye level. We know what's going on at a microscopic level, as we just showed. The embalmers, from a state funeral director association, are saying, yes, I'm seeing these things. They've been prevalent. I've been seeing them ever since the COVID virus and the COVID vaccines came out. Did not see them before that. So and now we have a new administration in, right? We have Donald Trump over here, and he's got Bobby Kennedy at the HHS, Dr. Marty McCary at the FDA, Jay Bhattacharya at the NIH. There's no reason that they should not be going out and investigating this phenomenon, doing their own research, so a retired U.S. Air Force major can actually finally retire and not have to do this to do their work for them anymore. So, I like to volunteer my services. I'm willing to work with the CDC and the FDA for free to, help them and give them the information that I've obtained over the last 3 years.
You've collected solid quantitative data over the past 3 years.
And I've sent it to them, John. Every year we do this. Right after I do the survey, I send it immediately to the FDA, CDC, and NIH. But in the last 3 years, crickets, John. Nothing back from them. So I'm begging them to change that now and to get off their rear ends and actually do some investigation, because the evidence is overwhelming.
And if any pathologists have seen this, I'm sure you'd love to hear from them as well, Tom.
Absolutely. Funeral directors, embalmers, cath lab doctors, cardiologists, endovascular specialists, vascular surgeons. We'd love to have them contact me at Thomas Haviland at sbcglobal.net.
We'll put that link on if you put that link. Tom, appreciate you sticking with this. I know it's a lot of work. But the onus of proof is on people to disprove this, really. This is a potential red flag. It's just mysterious that it's not in more medical journals, because these things exist. You hold them up in a jar, they're there, and people are seeing them, and yet they haven't been explained. It just seems incredible, and very few people have heard of them. It's just very, very hard to explain, really.
It is, John, but we'll keep pressing until the authorities do the proper thing. And because remember, those regulatory agencies are supposed to be protecting us, right, John?
That's what we pay them for.
Exactly. So they're not supposed to be hiding things for protecting other interests. They should be for us, the people.
Yeah, absolutely. Okay, Major, as always, thank you for your hard work and thank you for coming on.
Thank you, John.